Thank you very much, ladies and gentlemen. The Ministry of Health brings to the attention of the general public the ongoing strike action undertaken by the Ghana Registered Nurses and Midwives Association, born out of the ongoing discussions on the new conditions of service signed in May 2024 and originally scheduled for implementation in July 2024. Upon assuming office, we have, on behalf of government, engaged several times with the GRNMA to explore the best possible avenue to approve and implement the new conditions of service. While expressing our deep regret over the current impasse leading to the strike and the suffering patients enduring, the ministry states emphatically that government appreciates the invaluable contributions of Ghanaian nurses and midwives to the development of the health sector. Government remains committed to the needed engagement that will lead to the approval and implementation of the new conditions of service for nurses and midwives. Accordingly, government has directed the Minister of Finance and the Fair Wages and Salary Commission to, as a matter of urgency, lead the development of a roadmap to ensure a smooth implementation of the process. We engage the leadership of all Nurses and Midwives Association within the health sector on 30th May 2025 to address their challenges and discuss the subsequent roadmap leading to the implementation of the new conditions of service. Fortunately, the other associations supported my intervention, with the exception of the GRNMA, which declined and proceeded to declare the strike on the 2nd of June 2025, despite the NLC caution. The National Labour Commission on Thursday, 5th June 2025, summoned all stakeholders to an emergency meeting to address the matter. However, the GRNMA failed to attend the meeting. Consequently, the NLC was compelled to take legal steps to declare the strike illegal and called on the GRNMA to immediately call it off in line with law. Yesterday, Monday, 9th June 2025, we invited the Fair Wages and Salary Commission to engage the GRMA, the Minister of Finance, and the Minister of Health to deliberate on roadmap for the successful implementation of the new conditions of service. At the meeting, the Fair Wages and Salary Commission once again, in accordance with law, directed the GRNMA to call off the strike to allow negotiations to continue. Government wishes to stress its readiness to further engage with a view to implementing the conditions of service in a manner that does not dislocate the national budget. We wish to draw attention to the fact that the conditions of service under reference are not captured in the 2025 budget and will completely throw the economy off gear if implemented immediately in the manner it currently exists. We are mindful of the serious economic consequences of unbudgeted expenditure and want to avoid the economic slippages that led to the hardship in the recent past. Government commits to continue to engage with the nurses in order to achieve a mutually acceptable outcome in the interest of the public. While working around the clock to resolve the impasse, the Ministry of Health has taken the following steps to mitigate the suffering of Ghanaian patients unduly affected by the strike. The Ministry will, in the next few minutes, publish a comprehensive list of facilities to complement facilities where nursing services are lacking and where patients can seek health care. Given the urgency of the situation and suffering of the patients, government appeals to public-spirited retired nurses and midwives to volunteer their services for a brief period pending the resolution of the impasse. We further express our deep appreciation to practicing nurses who have opted to remain at post to help suffering patients and urge others to show similar fellow feeling and assist our ailing compatriots even as efforts are made to address their concerns. In conclusion, government reiterates its commitment to dialogue with the GRMA with a view to resolving this impasse for full nursing services to be restored. Thank you for the opportunity.